My name is Kekshan Shabnam. I am the student of Osh International Medical University from second year, Group 2B. And the drug that I am going to be talking about is called the barbiturates. It's a class of drugs called as barbiturates. So, what are barbiturates? The barbiturates are the sedative hypnotic medications, meaning they can cause you to feel relaxed or sleepy. For over a century, they have treated many conditions, including seizures, migraines, insomnia, and more. They are less common today because of the risk of misuse and certain side effects. However, they can be a backup treatment when others don't work. What are barbiturates? Barbiturates are the medications that cause you to relax or feel drowsy. They can also stop or prevent convulsions and seizures. The most common uses are for anesthesia reasons, treating epilepsy and non epileptic seizures, insomnia, and other conditions. Barbiturates belong to the sedative hypnotic class of medications. Sedatives are the medications that help you calm down and relax. Hypnotics make you drowsy. Their name comes from the word hypnos, which means sleep in Greek. Why do doctors prescribe barbiturates? In past years, barbiturates were a common part of general anesthesia in surgeries. That's because these medications help ease a person into a deep sleep. Today, other medications do this job better. However, barbiturates are still proven medications for treating many conditions. They also combine well with other medications like acetaminophen, Tylenol, or paracetamol to treat certain conditions. What conditions do barbiturates treat? Barbiturates can treat several conditions. The most common uses are preventing seizures, treating insomnia, pre anesthesia sedation, they help a person fall asleep quickly and pleasantly, and anxiety reduction, treating high cerebrospinal fluid pressure inside the skull or intracranial hypertension. What are the advantages of these medications? Barbiturates have many advantages. They are older medications, which means that they have decades of research to back them up. They can also serve as a backup when the first line medication does not work. One of the most important advantages of barbiturates is how they long last. Some of these medications are only effective for a very brief time, that's useful during a short medical procedures. What are the risks or complications of taking barbiturates? One of the main reasons barbiturates are not in common use anymore is that they have higher risks of certain side effecting, including tolerance and possible dependence or addiction. When should I go to the emergency room? For example, if a person is taking barbiturates continuously and he's feeling some kind of side effects, when up to which side effect should he wait till he goes to the doctor? You should go to the emergency room if you have symptoms of barbiturate overdose, which can look similar to alcohol intoxication. These include trouble breathing or dyspnea, confusion or trouble thinking, passing out or fainting, slow pulse or bradycardia. However, barbiturate overdose can also cause a fast or weak pulse, dizziness and vertigo, nausea and vomiting, low body temperature. Are barbiturates the same as benzodiazepines? Barbiturates and benzodiazepines aren't the same types of medications, but they are very similar. They both can stop seizures, cause you to relax and feel less anxious, or can help you feel drowsy and fall asleep when you receive general anesthesia. Thank you very much.
My name is Aruba Manzoor. I am the student of Osh International Medical University. Today, my topic is hypersensitivity and its types. Hypersensitivity it refers to undesirable reactions produced by the normal immune system, including allergies and the autoimmunity. These reactions may be damaging, uncomfortable, or occasionally fatal. Classifications of hypersensitivity reactions. The type 1, which is called as immediate atopic anaphylactic, and the type 2, which is called antibody dependent, type 3, which is called immune complex, type 4, which is called cell mediated or delayed type of hypersensitivity. Type 1 or immediate or anaphylactic hypersensitivity reaction. The reaction may involve skin, eyes, nasopharynx, bronchopulmonary tissues, and the gastrointestinal tract. The reactions may cause a range of symptoms from minor inconvenience to death. The reaction usually takes 15 to 30 minutes from the time of exposure to the antigen, although sometimes it may have a delayed onset from 10 to 12 hours. How to diagnose the type 1 hypersensitivity reaction? Diagnostic test from immediate hypersensitivity includes skin, prick and intradermal test, measurement of total IgE and specific IgE antibodies against the suspected allergies. Total IgE and specific IgE antibodies are measured by a modification of enzymes immunoassay. Increased IgE levels are indicative of an atopic conditions, although IgE may be elevated in some non-atopic diseases, example myelomas and helminthic infections. Treatment: drugs which can be used while giving to the type 1 hypersensitivity reactions, non-steroidal anti-inflammatories, antihistamines block histamine receptors, steroids, immunotherapy, desensitizations, also known as allergy shots. Type 2 hypersensitivity reaction, which is also known as cytotoxic hypersensitivity and may affect a variety of organs and tissues. The antigens are normally endogenous, although exogenous chemicals, heptans, which can attack to cell membrane, can also lead to type 2 hypersensitivity reactions. The reaction time is minute to hours. Type 2 hypersensitivity is primarily mediated by antibodies of the IgM or IgG classes and complement. Phagocytes may also play a role. The lesions contain antibody, complement, and neutrophils. How to diagnose the type 2 hypersensitivity reaction? Diagnostic tests include detection of circulating antibody against the tissues involved and the presence of antibody and complement in the lesions by immunofluorescence. The staining pattern is normally smooth and linear, such as that seen in good pastures nephrites. Treatment involves anti inflammatory and the immunosuppressant agents. Type 3 hypersensitivity reaction. It may be general, example serum sickness, or may involve individual organs, including skin. Systematic lumps, erythematosis, erythrosis reactions, kidneys, lupus nephritis, lungs, example aspergillosis, joints, example rheumatoid arthritis, or other organs. These reactions may be the pathogenic mechanism of diseases caused by many microorganisms. The reaction may take 3 to 10 hours after exposure to the antigen. It is mediated by soluble immune complexes. They are mostly of the IgE classes, although IgM may also be involved. The antigens may be exogenous, chronic, bacterial, viral, or parasitic infections, or endogenous, non organ specific autoimmunity, example systematic lupus, erythematosis, etc. The antigen is soluble and not attached to the organ involved. Diagnosis and treatment. Diagnosis involves examination of tissues, biopsies for deposits of immunoglobulin and complement by immunofluorescence microscopy. The presence of immune complex in serum and depletion in the level of complement are also diagnostic. Treatment includes anti-inflammatory agents. Type 4 delayed type hypersensitivity reaction. Reaction involves sensitized T cells and release of its lymphokines as mediators and amplifiers, mediated by cells rather than antibodies. The clinical states: contact dermatitis, transplant rejections, and granuloma. Type 4 hypersensitivity reaction releases cytokines to activate macrophages, causing inflammation and tissue damage. Continued macrophages activation can cause chronic inflammation, resulting in tissue lesion screening and granuloma formation. Response starting after 48 to 72 hours. Thank you.
Today's my topic is about oxymetazoline. Oxymetazoline is an important drug. The most common brand name that we call this in clinic is Afrin. We usually see this medicine used in winters when people are coming in with congestion and rhinorrhea. It is a synthetic direct acting adrenergic agonist, works on alpha 1 and alpha 2 receptors. It is usually given as a topical nasal decongestant. Topical nasal decongestant means you spray it up in your nose. You have a spray bottle and you spray it at the same time you inhale, and that mist goes back and covers the nasal mucosa and thus causing the effect. Now on to the mechanism of action. So this is again, it is a direct acting alpha 1 alpha 2 agonist. It works mostly on the alpha 1 receptor over the alpha 2. So alpha 1 is a vasoconstrictor, makes perfect sense why it works when we spray it up in the nose. If someone comes in congested, dripping and uncomfortable, this medicine is going to cause those vessels in the nasal mucosa to clamp down, thus decreasing the edema, which is the congestion and a little bit of the uncomfortable sensation, and decrease the rhinorrhea, which is the dripness, which can be causing a cough and other things. It really takes a few minutes for this drug to kick in. Now on alpha 2 effect, it works on the alpha 2 subtype A adrenergic receptor mostly, and on to the clinical uses. It is a great drug for a nasal decongestant, and also for epistaxis, which means nosebleed. Lastly, on side effects, first one is rebound congestion. It is also called as rhinitis medicamentosa. Basically, if patient use this medicine for more than a few days, if they use it longer than that amount of time, the nose is going to depend on that medicine, so that the nasal mucosa gets addicted. It has to have this drug, or else it is just not going to stop running. So tell patient to do not take it longer than 3 days. Other side effects include uh, burning and stinging inside the nose, nausea and insomnia, etc. Thank you.
Today my topic is about pantoprazole. Pantoprazole is substituted benzimidazole and protein pump inhibitor drug that inhibit gastric acid and secretion. It is used to treat gastroesophageal reflux disease GERD, a condition that causes gastric juice to flow upward from stomach and into the esophagus. It also treats condition in which stomach makes excess acid such as Zollinger illusion syndrome. It reduces the amount of stomach acid and help to reduce painful symptoms related to gastroesophageal reflux disease GERD. Mechanism of action: pantoprazole.
Hello everyone, my name is Akib Riaz. I am from OST International Medical University, second year, Group 2B. Today my topic is Montoleucost. Montoleucost comes under the classification of anti-asthmatic drugs. Anti-asthmatic drugs are those drugs which are leukotriene antagonist drugs. Since we know that leukotrienes are autocards, we have different kinds of leukotrienes, and in them we have cystinosyl leukotriene, which are produced by macrophages, eosinophils, and inflammatory cells in lungs, which and then they cause bronchial asthma. Mechanism of action: Montoleucost is completely antagonist to cystinosyl leukotriene 1 receptor. Normally, leukotrienes when binds with cystinosyl leukotriene 1 receptor, and after that they cause bronchoconstriction in the lungs, airway mucus secretion, increased vascular permeability, and also recruitment of the eosinophils. But in those patients, when we give Montoleucost, it binds with cysteine leukotriene 1 receptor and results in the bronchodilation, decreases the airway mucus secretion, and also decreases eosinophil count, and also leads to reduction of the hypersensitivity, thus decreases the risk of asthma attack. Cysteine leukotriene 1 receptors are agonistic drugs are useful in aspirin-induced asthma and exercise-induced asthma, but in case of COPD, montelukast has no value. Montelukast is usually used for mild to moderate asthma. Side effects: it is usually considered as safe drug, but some of its common side effects are headache, rash, flu-like symptoms, and earache.